My name is Susie Costello. I'm the Senior Clinical Director of Nursing at the Parker Jewish Institute. And I wanted to talk a little bit about what a resident can expect and their families can expect when they first come into Parker the first couple of days. Coming from a hospital to Parker is obviously very different, and lots of questions can be answered by the direct caregivers. So one of the things that we like to talk about is what to expect when we first come. Who are you going to meet? Who are the team players? So typically what we would do is we would reach out by telephone, the family, the following day after admission. It would be myself, the Director of Rehabilitation, Director of Food and Nutrition, and a social worker. We introduce ourselves. We talk a little bit about Parker. We talk about what to expect the first couple of days. And the day of admission, we'd be meeting lots of different staff members, physicians, nurses, social workers, dietitians. And at that point, it's really important that the families and the residents get to know who we are. After we get this information from the patients and the families, we begin to develop a plan of care. Patients and the families, of course, are very much of that plan of care. So their information, the knowledge they share with us is very, very important to us as well. Parker Jewish Institute receives many patients from hospitals that have had both knee and hip surgeries. Generally, after both knee and hip surgeries, gradual improvement is noted over a period of 6 weeks. Some residents will experience improvement at a faster pace than others. And during this time, residents will begin to experience less pain and discomfort, less stiffness and swelling at the surgical sites as they participate in both physical and occupational therapies. There will be significant improvement in their physical mobility with increased ambulation and ability to participate in activities of daily living. Residents need to pace themselves with physical activity, and important to note is that recovery takes time. Every resident heals differently and progresses differently. It is important for residents to be patient and positive during their rehabilitation and recovery. Taking prescribed pain medications is crucial for the resident to be comfortable while participating in their therapy programs, and as improvement is noted, the pain medications can be titrated. Your team members will include a physician, a nurse, a social worker, a physical and occupational therapist, a dietitian, and a recreational therapist. The physician will monitor your medical status, which would include prescribing medications and any follow-up appointments that may be necessary based on the resident's diagnosis at the time of the admission and throughout their stay. The physician will work very closely with the nurse managers who have 24-hour responsibility to ensure that nursing needs are met. In addition, the physician will be working very closely with other members of the nursing team as well, which includes certified nursing assistants and patient care technicians, who are responsible for the day-to-day care of the resident. The social worker is responsible for discharge planning and emotional counseling and is always available for any psychosocial support that is needed throughout a resident's stay. The physical and occupational therapist, after an initial assessment, will develop a plan of care specific to the needs of the resident and will determine a rehabilitation plan. Each resident will be assigned a dietitian who will be responsible for ensuring the appropriate dietary needs. Food preferences and choices will be honored to the extent possible based on the resident's diagnosis. The recreational therapist will be responsible for ensuring leisure activities and spiritual support whenever needed. All of these members of the team mentioned are responsible for working collaboratively together to develop a plan of care based on their assessments. The plan of care will be reviewed with the resident and their family frequently during their stay. And if there are changes to be made to the plan of care, those changes will be shared with the resident and their family. There will be a desire for more activity as residents heal, and at this time, there will be a noticeable improvement in ambulation. Throughout a resident's stay at Parker and on the day of discharge home, the resident will have received much education and guidance regarding the importance of following all therapy instructions, which will increase strength, activity, and confidence, monitoring for any pain or discomfort at the surgical sites, observances for any new onset of calf swelling or tenderness, which is especially important for residents who have had knee surgery, and the importance of keeping all scheduled appointments with their surgeons. There may be times during a resident's stay when they feel that they are not making significant progress or gains in their therapy program. It is our responsibility to recognize this and immediately intervene and address their concerns. This would mean bringing the entire interdisciplinary team together, which would include the resident and their family, and determine how to alleviate their concerns while offering support and encouragement. We recognize that residents are often anxious to get home, but it is our responsibility to determine when the time is right for discharge and continue to offer support to the resident and their family by continually updating the resident and family on the resident's progress. We hope you find this information helpful. If there are any questions regarding the patient's clinical status, please feel free to contact the social worker or nurse manager on the respective unit. Thank you.